Hi guys, this video is going to be about the transition from being a student nurse to a qualified nurse. I've basically got 3 negative points and 3 positive points, and I'm going to start with the negative just because I like to finish it on the positive, and then I'm also going to give some advice for student nurses just in terms of what to think about as you're coming up to qualifying. So the first thing that I'm going to say is that's different is the expectations of staff and particularly of patients and parents. So I found that patients and parents, whether you've been qualified 6 months or 10 years, you're still a qualified nurse in their eyes. So they have expectations that you're going to know things, that you're not going to forget things, that you're going to be good at what you're doing and really care for their children well. And obviously we can, and we're prepared for that. If you've qualified and if you've done your degree, you're prepared to look after these children. But it can be quite daunting as well. And there's not kind of that thing to fall back on of, oh, I'm sorry, I'm a student, and kind of being able to say, oh, I'll find out for you, or I'll ask one of the nurses. But you can say, oh, I'm new here and I've just qualified, so I'll find that out for you and I'll come and let you know. And most parents are actually okay with that, I've found. But the other thing is the expectations of the nurses. So I've had kind of different experience of this. Some nurses will really think, well, you're a qualified nurse now and you should know this, and you might have only been working in a place sort of, 2-3 months, but they kind of expect you to know things, and that can be really horrible because they can make you feel quite like you don't know things and that you're not good enough, and but also that can motivate you to study more. So it's kind of pros and cons of that, but that can be quite a negative thing as well. But also on the other side, I've had nurses that know that you're newly qualified and still kind of treat you a bit like a student, and will say things in a bit of, they're just trying to be caring and helpful, but it's kind of stuff that you know. So you've just got to be prepared for that and know that they're just trying to help, and just to do the best job that you can, and just to be confident in your own skills and knowledge, really. And the best way to do that is just to study the area that you're working in, and make sure that you know about your patients and are able to ask questions and are confident in that, and so that you're never kind of tricked out of knowing stuff. So anyway, moving on. The other thing, quite an obvious thing, is the medication. So as a student, you aren't able to check medicines, or you can be a third checker. In the places that I work, some places will let you second check, but most places don't allow you to check medicines. You can just check them for practice. But obviously, as a qualified nurse, you're taking full responsibility for the checking of medications, and also for remembering to give them. And I've had actually a few occasions where I've kind of got to the end of my day or got into the middle of my shift and realised that I've forgotten a medicine, and thank goodness it's never been anything really important that they've really needed. But I know of other nurses that qualify with me that have forgotten things that are kind of important medications, and it's not the end of the world. You're only human and you're going to forget things, so don't beat yourself up when things like that happen, but just be prepared for it and make sure you have a plan in place to remember the medicine. So I tend to write a shift plan from when I start to when I finish, and write down all the medications and the time that are due and tick them off as I go, and that helps me to remember them. Also just to check your drug charts as you go, because I found that doctors come and they write new medicines in and they don't tell you, and that's times where I've forgotten medicines as well, because I didn't even know that they were prescribed, because I check it in the morning, and if I haven't checked it for half the day and they've written something in the morning and I've missed it. So yeah, so that's kind of the advice that I'd give for that, but obviously you're responsible for that as a qualified nurse, but it's really nothing scary. I think lots of student nurses are scared about doing that, but it's fine, it really is. And the other negative thing that I found is that you do a lot more nights, and as a student I really enjoyed nights and they were my favourite shift, but as a qualified nurse I find it really hard because I'm doing nights every other week pretty much, and you just have to flip between nights and days really quickly. And obviously this is different in America, because I think you have day nurses and night nurses, whereas here, in most places, you work a 4-week rota, and in that 4-week rota you do 6 nights and 7 days. So it's quite full on, and you're usually working every other week nights, and that's been quite hard for me as well, but something I didn't find hard as a student. But anyway, that's really all the negative things I want to say. On to the positive things that hopefully will encourage you is that I found that I have a lot more time as a qualified nurse. So I'm kind of less tired in a way, because when I come home after my shift, that's my time, and my days off are my time, and I can do things that I enjoy and I can go away. Whereas as a student, all the time off I had, I was writing essays and studying and doing things for university. So you don't have that as a qualified nurse, and that's really great. But the sort of downside to that, again, is that sometimes you then lose motivation to study. So try and kind of get a balance between having downtime and having relaxation time, but also trying to study and the things to do with your area so that you know more about it. But it's quite nice because your days off are days off, and you get annual leave. We obviously didn't get annual leave as a student, so that's great. Also, the obvious thing is that you get paid for it. Getting money every month for doing the shifts is fantastic. It's a great motivation when you don't feel like doing it anymore. It's kind of, you get your paycheck at the end of the month and you're like, oh yeah, this is nice, from being a student for 3 years and not getting paid, or not getting paid very much if you've got a bursary, to kind of getting a good salary every month is really nice. And also, the thing that I've really liked is in shifts you can work more independently, and by that I don't mean that you're not team working, I mean just that you get to choose how you structure your day. So I found that as a student you structure it how your mentor wants you to, or how they tell you to, and I was really looking forward to, when I was a student, I was really looking forward to being qualified, because I could do things my way and organise my day how I wanted to, and that's something as a qualified nurse that I've really enjoyed doing, and I can kind of plan my day in the way that I want to plan it, and do things in the way that I want to. And especially I find looking after the babies as well, I like swaddling them, and I like getting them comfortable, and I like doing lots of developmental care with them that sometimes as a student you don't get to do. So I really like that. So that's pretty much the end of the video. I'm just going to say a few things of advice for students that are looking to qualify soon, or just looking ahead towards qualification. I'd say to study really as much as possible, because as I say, you don't get that much time to study when you're qualified, or you don't really have the motivation to do it, and you don't really have the motivation to do it as a student either. But it's really good that if you come out of university and you're qualified, knowing your stuff, it will really help for being qualified and being in that place where you are expected by patients and parents to be a qualified nurse, no matter if you've been qualified for a week or 10 years, as I say. So study as much as possible. Also, have practice when you're on placement organising your shifts independently, so try and make sure you get your own patients and organise your time well, so that you get everything done for that patient, because practicing that as a student will really help you when you're qualified. And also talk to qualified nurses, because I've got lots of really great ideas from chatting to other nurses about the things how they organise their days, and just things that I've never even thought about. So if you struggle with, say, organisation of your shifts, just say to someone, oh, how do you find organising your shifts? How do you do it? What's the best way for you? And see if there's a way that someone else might do it that might be really helpful to you. So I hope this video hasn't been too long, and I hope you enjoyed it and it was really helpful to you. And I'll see you soon in my next video, guys. Bye!